This is an educational module on hyperlipidemia. So you may be asking yourself, what is hyperlipidemia? Hyperlipidemia are fats present inside of our bodies, and they are from the food that we ingest. Lipids are water soluble, so therefore they're usually covered with a protein layer for effective transportation. As you see here, I've inserted a picture that shows a cholesterol plaque on the wall of the vessel, and it is blocking the transportation of the red blood cells. This can lead to more complications that we're going to discuss later on in the lecture. There are health promotion needs on hyperlipidemia. Hyperlipidemia basically just means high cholesterol in the body. It's a common diagnosis that is seen in the local community. It is a worldwide disease also that poses significant risk factors to the population. Some of these risk factors include coronary artery disease, cardiovascular events like a heart attack, and stroke. There is a learning gap identified in foods that may increase or decrease cholesterol levels. So we're going to discuss some of those foods later on. It is important to understand how to screen for hyperlipidemia to obtain appropriate diagnoses and treatment. According to a study, the best way to screen and diagnose hyperlipidemia is to obtain a fasting finger stick of cholesterol, LDL, HDL, and triglyceride levels. The National Heart, Lung, and Blood Institute considers high levels when a total cholesterol of 240 or an LDL of 160 is obtained. Fasting before a blood draw means that you should not have anything to eat or drink prior because it may alter the results. There are health prevention needs for hyperlipidemia. Hyperlipidemia is a preventable disease, so this means that it can be managed with lifestyle modifications such as diet, which is eating the appropriate foods needed to lower cholesterol, avoiding foods that may raise cholesterol, and then exercise, which that just means that you would exercise about 30 minutes a day to maintain a healthy lifestyle. It is important that you understand anticipatory guidance related to hyperlipidemia. According to a recent study, food education plus olive oil supplementation were able to lower lipid profiles of women with high cholesterol. Another recent study in 2021 compared the DASH diet and Mediterranean diet in patients with high cholesterol. The results of this study revealed that both diets significantly reduced cholesterol levels within the population. So the DASH and Mediterranean diets, I have a few examples of what the diets contain listed here. The DASH diet is something used for the heart, so it usually has a lower intake of sodium. It's rich in fruits, vegetables, low-fat dairy products, grains, poultry, fish, and nuts. The diet limits saturated fat, red meats, sweets, and sugar-containing beverages, which all of these items will significantly increase cholesterol levels. So that's just a few examples of that one. The Mediterranean diet has a high intake of olive oil, fruits, nuts, vegetables, and grains, so it's kind of similar there. It has also a low intake of dairy, red meat, processed meat, and sweets, which again, those will raise cholesterol. The difference is that it contains a moderate consumption of wine, which is one of those things where some people say 1 glass of wine a day is actually pretty healthy for you. So there's evidence to support that those diets do lower cholesterol. Again, here I've inserted a picture for you that has examples of the actual servings that are recommended in both the DASH and Mediterranean diet. So if you were interested in adopting one of those diets to help lower cholesterol, there's 2 options there with kind of a step-by-step instruction on the daily servings of each one. Cultural influence plays a major role in adopting healthy lifestyle modifications. The church community, for example, can offer support to lower cholesterol in diet and exercise. They can really help keep people accountable to lower cholesterol that will positively impact the overall health of your community. Your healthcare can also be negatively impacted if the family unit does not partake in lifestyle modifications to lower cholesterol. If you think about it, if you're the only one that's focused on eating healthy and adopting these lifestyle changes, and the rest of your family is not, it will be difficult to stay on track. So it's important to educate your whole family on the interventions to influence the adoption of these behaviors to lower cholesterol within your whole family unit. Environmental influence plays a major role in adopting lifestyle modifications to lower cholesterol. For example, a rural landscape makes it difficult to access resources like grocery stores and gyms, which would limit the ability for you to purchase healthier food options like fruits and vegetables and engage in exercise. You can overcome environmental barriers by driving to a local town with access to these resources, and it will in the long term prevent complications like high cholesterol such as heart attacks and strokes. Lifestyle influences also play a major role in lowering cholesterol. So, for example, a provider of a multi-generational household can have an influential impact on the whole family if they adopt lifestyle modifications to lower cholesterol. Developmental influence also plays a major role in lowering cholesterol. African Americans are more prone to racial discrimination, making them more prone to obtaining health problems. The developmental influence of parents on their children early on can influence decisions on participating in health maintenance interventions if they were involved in racial discrimination within the healthcare setting. So if they have experienced this, they may avoid things like screenings to detect high cholesterol levels, medication compliance, and follow-up appointments. It's really important for providers to provide culturally competent care to sway this population to participating in health maintenance interventions. It's important that they do this so that way we can detect high cholesterol levels early on and initiate treatment early to prevent complications. Learning style plays an important role in how we analyze, receive, and interpret information. So there are ways to identify your learning style, such as a quiz. Your learning style quiz resulted in both visual and auditory learning styles pretty equally. Therefore, you will benefit from a YouTube educational module on hyperlipidemia because it utilizes both imaging and lecture formatting to present the content. Health literacy plays an influential role in understanding medical information and in patient compliance related to high cholesterol. You are competent in health literacy because you are a college graduate and you obtained a 100% score on your health literacy test. Levels of evidence are types of evidence that are used in research. Level 2 research is a randomized control trial. It's basically whenever you perform an experimental test with a control and experimental group to show the difference of interventions. This study design is very good for understanding types of interventions because it compares lifestyle modifications and interventions that will decrease cholesterol levels, and it teaches you which interventions and lifestyle modifications to avoid that may increase cholesterol levels. Self-awareness is important in obtaining education on health topics such as high cholesterol. It is ultimately your decision to engage in these lifestyle and educational interventions related to treating hyperlipidemia. The provider's role is to determine your level of health literacy and to provide evidence-based information on health promotion interventions, but you must decide to engage in them. Adults are more susceptible to learning when a task-oriented approach is used, so this educational activity provides concise and step-by-step instructions to lower cholesterol. Adults are usually more motivated to learn by both extrinsic and intrinsic motivators. So extrinsic motivation is stimulated through education on the complications of hyperlipidemia. You don't want to obtain the complications like a heart attack or stroke, so therefore extrinsic motivation will push you to participate in the lifestyle modifications. Intrinsic motivation, on the other hand, is whenever you feel internally more energized for maybe losing weight or experiencing an ideal body image from adopting healthy habits. and that internal motivation may drive you to continue to basically live with the interventions to lower cholesterol. Here I have a list of references that were used in the creation of this educational module on hyperlipidemia. I hope you enjoyed it.